Hey everyone, and welcome to This Explainer. Today we're taking some really critical medical research about our hearts and we're turning it into something, well, colorful, pleasant, and way more attractive with image representations. Because honestly, the goal here is to give you an empowering tool to keep yourself and the people you absolutely love safe and sound. So let's just jump right in. Okay, picture this. A sudden chest pain hits. Maybe it's late at night, and suddenly you're forced to play this terrifying guessing game. Is it just that spicy dinner you had giving you heartburn, or is it a life-threatening emergency? It's an incredibly scary position to be in. And surprisingly enough, the data shows that as humans, we are just ridiculously prone to making the wrong guess. When that discomfort sets in, our brains instantly try to rationalize it away. We tell ourselves, oh, it's just a bit of acid reflux. But what exactly happens when we guess wrong? Well, according to a really fascinating study out of a university hospital in Istanbul, Turkey, 2 hours is the massive median delay time before patients finally seek medical help for a cardiac event. Think about that. 2 whole hours. And remember, that's just the median, meaning a ton of people waited much, much longer, sometimes even up to 10 days. 10 days! Now, during a heart attack, the absolute most critical window for treatment is right at the very beginning. So why on earth are people waiting so long with a potentially fatal condition? The human psychology behind these delays is it's fascinating, but it's also super dangerous. Nearly half of the people, like 48.4%, simply wait around for the pain to pass. Another 39.8% actively try to calm themselves down, literally convincing themselves it's nothing serious. Others blame the pain on getting older, or maybe an existing chronic disease like arthritis, or just general indigestion. Basically, they rationalize the symptoms. But here's the thing. In the context of a heart attack, this kind of denial, it's a fatal mistake. So let's clear up this confusion and compare the sensations side by side. Gastric pain, or heartburn, is typically exactly that, a hot, burning sensation right behind your breastbone. It might come with a sour taste in your mouth, maybe some excessive burping, and it almost always gets worse if you lie down. A heart attack, on the other hand, it's rarely ever described as burning. Instead, patients describe this heavy, crushing weight, an intense, gripping pressure, or a severe feeling of suffocation. Honestly, it feels less like acid and way more like an actual elephant is just sitting right on your chest. This brings us to a really crucial point. You have to look for associated symptoms. It is not just about the chest. Look for sudden, profuse sweating, often called pasina in India, without doing any physical work at all. If someone suddenly turns super pale, starts vomiting for absolutely no apparent reason, or if they take an antacid and find zero relief within 2 to 3 minutes, guys, these are massive, screaming indicators that you're not dealing with a simple stomach bug. Now, let's talk about the amazing science of referred pain. This explains exactly why your heart's distress signal might actually pop up in a totally different part of your body. You see, your heart doesn't have the same highly specific pain receptors as your skin does. So when the heart muscle is literally starving for oxygen, it just sends these panic signals straight up the nervous system. The brain gets these signals, sure, but it gets kind of confused about exactly where they're coming from. And that's because the heart shares nerve pathways with several other body parts. And this brilliantly illustrates why pain radiating to your left arm or your jaw is a massive red flag. Like drop everything and go to the hospital right now kind of red flag. Your brain is basically misinterpreting the heart's distress as coming from these specific red flag zones. If you feel chest pressure and suddenly your jaw starts aching, or this dull pain spreads down your left arm, or right into your upper back between your shoulder blades, I promise you that is not a muscle cramp. That is your heart crying out for help. Okay, but let's throw a little curveball into the mix here. We all know the classic movie scene, right? A guy clutches the center of his chest and just falls over. But what if a cardiac emergency doesn't look anything like that dramatic Hollywood chest clutching? What if, amazingly, the chest feels perfectly fine? Well, this brings us to some really vital research published in the International Journal of Pharmaceutical and Clinical Research. The researchers found that for certain types of heart attacks, specifically things like inferior wall infarctions, which affect the bottom part of the heart, patients very often present with highly atypical symptoms, meaning they might not experience that classic chest pain at all. And as you can imagine, this leads to incredibly dangerous misdiagnoses, not just by the patients themselves, but honestly, sometimes even by initial medical screeners. For patients who experience absolutely zero chest pain, the data paints a wildly different picture. Get this. A staggering 45% experienced severe shortness of breath as their primary symptom. Another 25% presented with sudden vomiting,
and another 25% with excessive sweating. Just think about that for a second. If you suddenly can't catch your breath and feel sick to your stomach, your mind probably jumps straight to a stomach bug or maybe a panic attack. But this data proves that even without an ounce of chest pain, these symptoms can mean the heart is in serious, immediate trouble. Which leads us straight to this incredibly powerful quote. It's basically the golden rule for immediate care in the Indian context. If you are confused, treat it as a heart attack. Seriously, do not waste time asking your neighbors what they think. Do not just sit on the couch Googling your symptoms. It is 1,000 times better to rush to the ER and be happily told by a doctor that you just have some trapped gas rather than waiting too long at home and causing irreversible damage to your heart.
So if you ever suspect you or someone else is in trouble, here is your immediate action plan. Step 1. Make that emergency call first. In India, you're dialing 108 or 112. In the US, it's 911. Just get professional help on the way. Step 2. Consider taking immediate aspirin. But, and this is a big but, keep in mind you should be informed of the basic risks, be absolutely sure you aren't allergic, and ideally take it under advice from emergency dispatch. And step 3. Rest and stay completely calm. And most importantly, do not drive yourself to the hospital. Your condition could deteriorate way too fast on the road. I want you to remember this profound medical truth from the British Journal of Cardiology. Time is muscle. I really want you to absorb that phrase for a moment. Time is muscle. Every single minute your heart is deprived of oxygen-rich blood, cardiac muscle tissue is dying. And that tissue, it does not grow back. Every single second you save by recognizing these signs and acting immediately directly protects the heart from permanent, life-altering damage. And really, that brings us to why we make these explainers in the first place. Please share and subscribe if you like, for a healthier friends in society. Because honestly, we are happy if we are healthy and the people around us. Sharing this knowledge isn't just about passing along a link. It might literally be the exact thing that saves the life of someone in your network tomorrow. So, I'll leave you with this final provocative thought. Knowing what you know right now, could you spot the hidden signs of a heart attack in your loved ones today? Are you ready to use the superpower to protect the people you care about the most? Thank you so much for joining me for this explainer. Stay healthy out there, and I will see you on the next one.